to the Workforce Connections podcast, where we discuss workforce development in Southern Nevada. Here's your host.
Hi, and welcome to another episode of the WC podcast. Today, we have another very special guest, my fellow board member from the Las Vegas Global Economic Alliance, or LVGEA. Please help me welcome Brian Kleven, Nevada Market Chief Financial Officer for Dignity Health St. Rose Dominican Hospitals. Brian, welcome to the podcast.
Oh, thank you so much for having me, Jaime. It's a pleasure to be here.
Yeah, I know we've been looking forward to this, so I'm so happy you're here. Let's dive right into it. I want you to start by telling our audience, our listeners, those of us who don't know you, where were you born? Where did you grow up? Where did you go to school, college, and perhaps your first job out of college? Take us through that journey.
Oh, great. So I'll give you my life story. So I was born in Van Nuys, California, in San Fernando Valley, where recently there were some wildfires in that area, but my family's been okay, and certainly praying for everyone there. I was raised in the Northridge area, Porter Ranch specifically, lived there till I was 28 years old in various locations throughout Northridge and the San Fernando Valley. I got my undergraduate degree at California State University in Northridge. It's a business administration degree with an emphasis in finance. After I went through my undergraduate career, I met my wife. We were married and moved to San Diego after working in various healthcare jobs. My first job during college or right after, I worked for a bank, Washington Mutual back then. Now I think they were swallowed up into JP Morgan Chase many years ago after the banking crisis. I was an online banking specialist where I took phone calls and customer service and helped people with online banking when that was a newer service in the banking industry. I had a previous job before that during college where I was an administrative assistant for the MBA program at California State University, Northridge. That was one of my very first jobs as a young person attending college there. It was great. I really learned a lot about customer service. Taking calls in Washington Mutual, I dealt with all types of people, all customers, some just curious, learning things, others of anger and other frustrations. So I really learned a lot in that job. I worked in that for a couple of years. Eventually moved to San Diego, and then was into healthcare after banking. I worked at Encino Tarzana Medical Center when they were parts of Tenet Healthcare. Then went to USC University Hospital and Norris Cancer Hospital for years. Then I was recruited. I went back actually to Valley Presbyterian Hospital in Van Nuys. That was where I was born. Ironically, went to the hospital where I was born at, worked there as a controller for a while, and then was recruited out to San Diego to a hospital to be a controller at Alvarado Hospital, which I think is now UCSD East Campus, and then was eventually recruited out here. And 9 years ago, I was recruited by Dignity Health St. Rose Dominican to be a chief financial officer, and I'm now running the whole market as the financial leader.
That's great, and that's good for us here in Southern Nevada. Take me back a little bit. Cal State Northridge, is it the school where Reggie Theas from UNLV went to coach basketball? Is it by Topanga Canyon inland?
I don't know if that's where he's at. It's right on Reseda Boulevard in Nordhoff, down Topanga Canyon. I think that's a smaller university, I believe, but I could be wrong. I'm not sure where he's at.
But those are the places where you had your childhood and your college years.
Yes. Okay. Yeah, all Northridge most of my life till I was 28. Wow. And I was in various places. I became a young adult in college, lived in different houses and apartments, but all in that area. Okay. And then eventually went to San Diego and was in a few homes there, and then now live here in Henderson. Love it.
What's the area after you pass Northridge? If you're going to Thousand Oaks, Ventura, the Ronald Reagan Freeway. Mm-hmm. Right after you pass Northridge, there's that area.
Like Simi Valley, is that what you're thinking? Yeah, Simi. That's where the Ronald Reagan Library is, presidential library. It's a beautiful area, very safe city too. Yeah. I haven't been to it in a while, but I go see my parents in Northridge still every now and then. It's always great to connect with them.
I asked because my daughter spent 4 years in Thousand Oaks, California in college, and I used to always land in Burbank and drive by Northridge to go up there. And
Oh
see
yeah,
her. Yeah.
yes. And you know the 118 freeway is kind of an axiom that connects to the 405 and then the 5, and then you go down to the 101. It's all intertwined in that area.
Yep. Well, we're grateful to have you here. So now,
Thank you.
Tell us about the key responsibilities that you have and your role and the challenges that you face, managing the financial operations across 3 acute care hospitals, the medical group, and several other large-scale joint ventures here in Southern Nevada.
Yeah, it's a lot to take in. There's certainly amazing people, employees, physicians, world-class physicians and employees at Dignity Health St. Rose. I'm very privileged to be working with them. They really provide world-class care. The financial challenges are more between our organization, insurance, health plans, other stakeholders, suppliers, vendors. It's difficult to manage it all, so you kind of have to unpack it. The first thing is on the revenue line. We get paid very differently than any other industry. We don't set prices per se. We negotiate with insurance plans that then insure their members. So Medicare is the largest one. That's the federal government, and they have set rates for things. Then there's all the various Medicaid plans. There's a state-run Medicaid fee-for-service plan, and then managed Medicaid plans that help provide insurance to people, and we negotiate rates with them. There's also, I skipped over, Medicare Advantage plans. That's not the actual federal government, but insurance health plans that are managing Medicare Advantage plans. And then we have all the commercial health plans and a few others. So we negotiate rates with them to provide services for their members. We take care and we provide service to everyone who walks in our doors. We are a not-for-profit, faith-based entity. So anybody who comes in, regardless of their ability to pay, we treat and take care of those patients. And we're proud to do so. In fact, it's our privilege to do so. The expenses has been the difficult thing in recent years, particularly after the COVID-19 pandemic. There's inflation, often referred to as that, where just, as dollars were thrown out, it causes everything to rise in expense. And then there's just expense growth in general. We give increases to our employees. We provide very competitive and amazing benefits as an organization. We are a member of Common Spirit Health. That is our parent company that is the largest not-for-profit health system in the country. So we're very blessed to be in that group that can help us and back us. So Common Spirit Health is a great employer and treats its members well. Everything that we buy and use in the hospital has become more expensive over the years, whether it's an advanced piece of equipment for surgical intervention or just very basic things that we need for patient care, like gauze. Everything is more expensive. It's also more costly to provide purchase services and repairs and upkeep of the facilities. So I went through a lot there, but that's what we're unpacking, and really, I view them as opportunities. How can we improve healthcare here, which requires investment? So we technically need more help from everything. We need more revenue from the revenue streams that we have, and we need to control the expenses as best we can while providing great service to the patients that we serve. So it's a very complex industry, healthcare. We're one of the only industries I can think of where we provide service proudly, and then we might get paid. Any other business that I can think of, you have to pretty much pay up front. Yeah. But healthcare is different. It is a right and not a privilege in my mind and our company's mind. So we're proud to do it, and we work through it.
Wow. And I happen to live right in the middle of 2 facilities. A little bit, east of me is the original St. Rose campus on Boulder Highway.
Yeah, Rose de Lima campus, yes.
Yep. And then a little bit west of me is the brand new one on St. Rose Parkway.
And Eastern. Yeah, that's our Sienna facility, yes.
And then, of course, if you cross over to the west side of town is the St. Martin facility,
San Martin,
right?
Yes.
The interesting thing about the 3 is, St. Rose de Lima, or in Spanish we say Santa Rosa de Lima, and or St. Martin, who in Spanish is San Martín de Porras. They're two Catholic saints from the country I was born, which is
really?
Peru. Yeah.
Yeah, and Martin de Porres was the patron saint of animals, I believe, which is interesting. And then Rose de Lima, and then Siena is Catherine of Siena. We are rooted in our Catholic traditions, and the founding congregation is the Adrian Dominican Sisters from Michigan, who were actually involved with Bishop Gorman himself with founding the facilities after the original campus that you mentioned, Rose de Lima. It's a very interesting history. It goes all the way back to World War II. Wow. That hospital was run basically by the War Department in support of the Allied war effort. And there were sisters from Adrian Dominican and the Catholic community came together to operate it while there were factories building warships and warplanes. And also there was a mining effort, mining precious metals for the Allied war effort, specifically magnesium. The hospital at that time was called Basic Magnesium, I believe. Wow. And then after the war ended, the hospital was going to be shut down, and the Adrian Dominican Sisters purchased it for $1. I think it was $1 for several years, but still a good deal over time, and then maintained and ran the facility all those years. And there was not much in Henderson back then, not even much in Las Vegas.
That's right.
There was the Flamingo, I believe, was the only hotel around and casino. And it's been running for 70 plus years all this time. And then we've since expanded to the Siena campus on St. Rose and Eastern. That's our flagship campus, which is the only trauma center in Henderson. And then San Martin campus over in what I call that Mountain's Edge area, maybe right along the 215 Beltway off Durango and Buffalo. Great facility there too that provides advanced services as well.
Yeah, you were talking earlier about how ironic life is. You know, sometimes you go back home to the city you went to work in a hospital. Again, for me, growing up in Lima, Peru, I grew up, or the district that I lived in and was born and live is called Rimac, which is in the border. There's a river that divides Lima and Rimac, and if you cross the bridge, there's the place where St. Rose lived and died, and a wishing well. And I went there as a child, and little did I know, that coming here, less than a mile from my house, there'd be a hospital named after
There's
her.
a correction after the patron saint there. That is incredible. I'm glad we have that connection.
It was pretty cool. So obviously you're here today at Workforce Connections, and one of the big issues that every employer faces is workforce shortages, and how in the long term we're going to develop the talent we need as an economy to keep growing, not just in Southern Nevada. But tell us about the maybe any role that you might play, not just with Dignity, but the healthcare industry at large. What's happening to address this shortage?
Well, there is definitely a shortage. It's a need in probably most industries. In healthcare, we rely on talent and workforce to come through for a variety of positions. There's obviously the medical and clinical side, so physicians, advanced practice practitioners, but then there's also just every skill set job that is very specialized and unique in a hospital or in our medical group, our clinics. Respiratory therapists, registered nurses, certified nursing aides, pharmacists, the list goes on, lab technicians. So it's important that we partner with others in the area, particularly higher education. I would mention several of them: Touro, College of Southern Nevada, UNLV, Roseman, Nevada State University. They're all great partners in providing a pipeline of these really specialized workforces that we need. They partner with various leaders, including myself, to make sure that we're helping how we can. Do we need to come and help with classes? How can we provide support? And also, how do they, in turn, train people to be ready for the workforce? Dignity Health or Common Spirit Health in general, we offer very competitive rates. We are a firm believer that we need to pay well and offer great benefits to people so they want to come work. That's how you recruit the best. So that's what we target. And then broader healthcare is a very rewarding career, I would say, for people. My mother is a nurse, registered nurse. She worked for decades and still does occasionally. She loved that job. It's a career where you're helping people. So it's one of those that I think is very rewarding and can sometimes be a calling to people. So we take privilege in that. And we just work with various partners, stakeholders in the community. We're all part of a stakeholder symbiosis in a lot of ways. I would say also in from the community standpoint, the two foundational pillars of a good community, in my opinion, are healthcare and education. So we go hand in hand, in my opinion. So that's how we kind of tackle it.
And the next hot topic, Brian, that everybody's talking about, of course, is talent, which, again, is like you said, the talent pipeline starts with the K through 12 system, but then it goes through the whole post-secondary education to higher education. So education is very big pipeline. But technology is something that's really impacting the workforce as well. Is there any advances in technology that are impacting healthcare in the next few years and decades?
Oh yes, great point. Always is. I'll say in any industry, especially lately. I mean, I'll probably be repeating a buzzword you've heard a million times. Artificial intelligence is the talk of the town. But there's also just medical equipment advancement that continues to be made and has been over the last decades, but it seems to be accelerating. And I believe it's coming far sooner than many people believe.
Like robotic operations?
Oh, yeah. We already do robotic-assisted surgeries, particularly with our Da Vinci robots from Intuitive and other companies. And they help surgeons for really advanced surgical placement to make sure there's reducing errors. And then there's all sorts of other equipment coming out. How can we have cleaner air in the hospitals? Do we need purifiers? So there's always technological advancements. The big one being talked about now is artificial intelligence. How can we incorporate that to help the needs of our patients? How can they help the physicians in their review of care and direction of the care? It's almost like a check and balance. Hey, the physician has amazing training. We're very privileged at St. Rose, where they're just world-class physicians, but an AI platform can help provide a check and balance, more things maybe they didn't think of, real time right there, make sure the documentation is perfect. So that we're looking at incorporating that into our clinical systems. It's already underway across our entire system, and I'm sure other health systems. So it's more and more will be coming, and we try and stay at the forefront of it. And then as equipment technology advances, more and more things can be done in different settings other than a hospital, an outpatient setting. Our ambulatory surgery centers, that's one of our joint ventures that we have, where it's more outpatient and easy, quick and easy, and more affordable, usually a lower cost. So we're trying to push all those initiatives to help the patients.
Another thing I thought, Brian, my most recent visit to a hospital was, I remember the day where you would take x-rays and you'd have to wait for them to be developed and carrying them in these big yellow envelopes. But now they can email them to you.
Yeah.
Digitized,
Yeah,
text them.
we offer a patient portal that you can go in and see it. Not exactly real time, because you have to wait for a radiologist to interpret it, make sure it's a good image, but very quickly. And you can see it, the patient can see it very quickly. And then we want, if they ever need it to take somewhere, we can put it on a CD or something more portable to get to them. So yes, all of that continues to happen. And it's certainly different than it was 30 years ago. Yeah. It continues to advance.
All of it for the betterment, as you said, to provide better services.
Right.
So, Brian, here in town, is there an initiative or a program that you're proud of, would like to highlight that's, again, specific to supporting the Las Vegas community in any of the...
Sure. I think all of the health systems are trying to create, how can we offer more and better services here in Southern Nevada specifically. Las Vegas and Southern Nevada, Henderson, North Las Vegas.
Boulder City.
Yeah, all are just great communities of people. So how can we bring access to care to those places so you don't have to drive inland too much from the outer areas? How can we expand physician access? There is a shortage of physicians here in Southern Nevada across almost every specialty and primary care. So we are making significant investments in physicians and clinics, primary and specialty clinics, so that we can provide them throughout the city. That's going to take time, of course, but we're working on it. And also, how do we bring sites of care to the outer areas as Southern Nevada continues to grow and expand, which I think it will. I'm still very bullish on Southern Nevada. It's a great place to live and raise a family. It's a great place to be in general, so it will continue to grow.
Yeah, we're seeing it now with the temporarily with a lot of families from California, but that might turn into more permanent.
Oh, yes.
Option. Yeah.
I think it's a very attractive place to come to. I think it was one of the best decisions I ever made, moving my family here. And my kids were young at the time, and it has been great. Yeah. It's wonderful, so I love it.
That's good to hear. And Brian, as we, again, see each other often at the Las Vegas Global Economic Alliance board meetings, we just established a 10-year goal. It has a lot to do with healthcare, because we heard from our peers that to move into the next chapter of greatness for our community, we have to have, again, continue to improve our healthcare system, and you're a big part of it. So how do you see, again, and within that 10-year goal that we have at the LVGEA, I think physicians was a big part of it.
Oh, yes.
The capacity of physicians. What other things have to get better for us to, again, be able to compete against other regions to bring people, because we do have a better healthcare system?
Yeah, the Las Vegas Global Economic Alliance is really a great group of community and business leaders like yourself and others, and we also have, it's a public-private partnership. So you have the municipalities as well. You've got the mayors of the cities, the county commission is represented, the governor's office is represented. So you have direct access to kind of partner and bolster up the system. I think the key to that 10-year target is we want to recruit businesses that are not here. Most things that, and I usually am hospital centric, because we purchase a lot of things in hospitals and to expensive, very high dollar amounts. And we're mainly procuring that from outside of the state of Nevada because it doesn't exist here. Things aren't manufactured. We don't have a big pharmaceutical representation here. So it's how do we attract those companies to come here, bring good paying jobs here for families to live, and also then we can really get more research here through those companies. And there's so many to name, but just I think of biotech industry being here, just the general supplies that we're buying in hospitals could be made and manufactured here and then procured here. And I would think advanced surgical instrumentation could be here as well. How can we have those robots that we talked about, the robotic surgical assistants, how can they be built here? So it's how do we attract those businesses and get them here for good jobs? And then that will bring a research element here for subspecialists, advanced specialists, doctors, and others that can then bolster the healthcare system.
I love that, Brian, because as you know, we're now welcoming a big company, Haas Automation, to Henderson. And they always refer to as the machines that make the machines. You find them in places where they make cars, where they make robots, where they make all kinds of things. And so they always talk also about the fact that they're coming here also with the expectation that their supply chain will follow them. And so that's what you said.
Right.
And that would be a great goal for us, I think, to accomplish that, to make sure that the healthcare industry has a healthy supply chain here built out as well.
Yeah, and it takes a team to do it. So that's why there's so many people on that board and all the respective areas involved in, because it's going to take a group of team. And it's a 10-year target because it takes time. Yeah. It simply isn't going to happen overnight. Can't snap your fingers and say, move all this here, but we're going to go after it. I think this is a very attractive place for any company, and including healthcare companies. So it's a worthwhile goal.
Well, Brian, I want to switch off work a little bit and pivot, because obviously you're a very busy guy with a lot of responsibilities, but I do believe and hope that you find time outside of work to do things that you enjoy. What hobbies and activities do you and your family enjoy when you have spare time?
Oh, man. Well, I'm a family man at heart. So my wife and I have 3 children. They're teenagers. 2 are in high school, 1's in middle school. I spend as much time as I can with them. We generally like to do sports and things like that, but more just us as a family outside throwing a football around, having fun in the park. We travel a little bit, generally around southern United States. We'll usually go back to California, where my wife and I have some family. Yep. We'll go up to Seattle, where my brother is, and we like to travel within the states here and there. So we do all sorts of those activities. For me, I love to watch sports. Okay. I am a football fan.
Live
NFL.
Or on TV?
Oh, both, if possible. But I usually won't travel outside. I really am a big fan of the Las Vegas Raiders and the Vegas Golden Knights and UNLV athletics, so I try to attend those as much as I can.
Those are our peer members of the LVGEA.
Yeah, they're good. I will, and then just watch on TV. I love mainly football and hockey, and baseball with the athletics coming, I think is a great opportunity as well.
Lots of choices. So I heard you say that not only do you practice sports with the kids, but you also involve them in the sports watching. You bring them to the games with you and whatnot.
Yes, I try to. They're teenagers. Hard to get them to come out with me now. When they were younger, they loved coming out with me. But they enjoy it. They're great kids. They get good grades and do a great job. So I just try and be as good of a husband, as a father as I can be.
That's good. And Brian, talking about kids, you and I one day, believe it or not, we're young kids too. You know, the gray hairs don't. But I often think about if I could speak to that 18-year-old me, and I would avoid him so much pain and disappointment if I had back then the wisdom and knowledge I've gained over all these years. And so, what would you tell? Not just the 18 version of yourself, because I don't know if we'd listen to ourselves, but a young person today who's looking and saying, hey, I come from California, I just moved to this town. I'd love to one day become a successful business leader like Brian. What's the secret sauce been for you that somebody could benefit in their young life today?
Oh, wow. Appreciate your kind words. I would... it's hard to think about, and you're right. Like, would I listen to myself? I'll take out the investment advice because I would definitely go to that. But I would tell myself, don't be afraid to take risks. I think when I was younger, I was very risk averse. You can't be afraid of failure. I think I learned some things and I do okay, and it was because I failed and learned from it. So don't be afraid of that. Embrace it and work hard and be a good community member and help others as much as you can. That sounds so simple, but I would try it. And I don't know if I would have listened to that a long time, especially that long ago, but I would tell myself there's good things. There's more to life than money or anything like that. I would say, be a good person, be a productive member of society, and take risks. Yeah. That's what I would say.
I think the earlier, the better it is to absorb failures, as you said. You forget about them, you learn from them earlier. But I also like what you said, because we've had, as you can imagine, many folks who have said, save more was their advice.
Yeah, right.
Listen more, speak less, all kinds of things. And they're all valid, but I really, it means a lot to me too, because I was risk adverse too. I probably still am very much risk adverse, but I've always have told my children, best time to take risks before you have kids of your own, before you,
right, exactly.
own things and have big jobs. And so that's great advice. So.
Oh, thank you. Yeah, no doubt.
Well, Brian, it's been a pleasure speaking with you. Again, always when I see you at LVGEA, the thing I remember those, you're always smiling. You love your job, have a great family, because you're always happy. I try to be. Yes, absolutely. I appreciate it. Yeah. Thank you so much for having me. Thank you for being here, Brian. All right. All right. Well, that's another episode of LWC Podcast. We hope to see you another one soon. Until then, stay safe. Well, Brian, thank you for staying over to do our bonus segment called Against the Wall. Are you ready? I'm ready. All right. The first section is called Your Favorites. I'm going to give you a category. You're going to give me your favorite thing in that category. Let's start with an easy one. What's your favorite food? Seafood, particularly shellfish. What's your favorite beverage with that shellfish? Ooh, cherry Coke, my all-time favorite beverage. The favorite car you've ever owned? Tesla, Model 3, easily the best car I've ever owned. Your favorite musical group or artist? Well, I'm going to go with Red Hot Chili Peppers. Your favorite movie? Braveheart, a great movie. Favorite book? The Bible. Favorite college sports team? Ooh. UNLV. Favorite professional sports team? I got to go with the Vegas Golden Knights. Very good. Kerry will be very happy when we see him. And Keith Whitfield will be happy. Oh, yes. All right. Second segment is called Tough Choices. It gets a little more difficult, and I want you to try to choose one of the two choices. Are you ready? Oof. I hope I'm ready. Yes. Vacation or staycation? Vacation. When you go to that vacation, would you rather drive there or fly there? Drive. Once you get there, stay in a hotel or an Airbnb? Hotel. When you retire, Brian, will it be on a ranch or in the city? City. But my wife might have something to say about it. She might. Very good. We got to check with her. If you had a day all to yourself, would you rather spend it by the ocean or hiking in the mountains? By the ocean. If you were a superhero, would you rather have the ability to fly or to breathe underwater?
To fly.
Would you rather have the ability to speak with animals or speak any foreign language?
Any foreign language.
Here's where it gets harder, Brian. Actions or words?
Actions.
Justice or grace?
Justice.
Well, you finished the second segment. The third one, I'm going to give you 95% of a sentence. You're going to finish it for me. Are you ready?
I'm ready.
If Brian could visit any place in the world, it would be?
Italy.
The best part about living in Southern Nevada is?
The people.
Brian's favorite thing about his job at Dignity Health is?
The mission.
If Brian could travel back in time, he would travel to?
World War II.
And 3 words that describe Brian are?
Funny, handsome, and kind.
I couldn't agree more. Great job. Doing the WC podcast here today with us was?
Amazing.
Well, Brian, thank you for being here.
Thank you, Jaime.